I'm a physician, and most weeks a man in his 50s or 60s steps into my office, closes the door, and lowers his voice. "Doctor, I used to be ready anytime, anywhere. Lately, it's different. I want to be there for my partner, but sometimes my body doesn't follow." He isn't alone. What you're experiencing is common, deeply human, and, most importantly, changeable. This isn't the beginning of the end. It's the beginning of understanding how your brain, hormones, blood vessels, and relationships evolve with age, and how to work with that reality so your sexual life stays strong, satisfying, and confident for decades. So, today, I'm going to give you some tips on how to stay hard. So, first, let's name the loudest saboteur: worry. Performance anxiety doesn't just live in your head, it constricts blood vessels, tightens the pelvic floor, and pulls your nervous system into a threat state. The more you anticipate a problem, the more your body practices the problem. This is called spectatoring, monitoring your performance from the outside rather than feeling from the inside, and it blunts arousal. We break that spiral with 2 moves. One is mindset: you are not broken, you are adapting. Desire itself changes with time. It shifts from being almost purely spontaneous to more responsive. Context, connection, and safety matter more. That's biology, not failure. The other is physiology. Slow breathing lengthens your exhale, lowers adrenaline, and improves penile blood flow. 6 long breaths before and during intimacy can tilt your system back toward pleasure. It sounds simple. Physiologically, it's potent. Now the medical truth that too few men hear soon enough: erections are a vascular event. If blood pressure, cholesterol, blood sugar, or inflammation are off, your penis may notice before your heart does. Erectile changes can be an early warning sign of cardiovascular disease by 3 to 5 years. I urge my patients to treat this as an invitation, not a verdict. Get a checkup. Ask for blood pressure, fasting glucose or hemoglobin A1C, fasting lipids, thyroid screening if symptoms suggest, and a morning total testosterone, with follow-up testing if it's low or borderline. If you snore or wake unrefreshed, evaluate for sleep apnea. It's a major fixable driver of low libido and erectile problems. Address the health of your arteries, and you address the health of your erections. With age, arousal often becomes more relational and more sensory. Many men tell me that in their 20s, visual novelty was enough. But by their 50s, touch, scent, voice, humor, and emotional safety carry more weight. Neurologically, dopamine's fast spark gives way to oxytocin's steady glow. The prefrontal cortex, the part that values meaning and trust, starts to play a larger role. When you lean into this shift, slowing down, staying curious about your partner's body, and letting foreplay become the main course, you're not compensating, you're upgrading. Couples who prioritize connection report better function and higher satisfaction across the board. And sex therapy research consistently shows that sensate focus exercises, non-goal-oriented touch, reduce anxiety and restore natural arousal. Okay, so let's talk muscle and movement, because your pelvis is more than bones, it's a power system. The erectile lift you feel is supported by the pelvic floor, especially the bulbocavernosus and ischiocavernosus muscles. Just like biceps, they weaken if neglected and over-tighten if stressed. Targeted pelvic floor training improves erectile function and ejaculatory control in controlled trials. Imagine you're stopping the flow of urine and a bowel movement at the same time. Hold gently for 5 seconds, relax fully for 10, repeat, and build sets over weeks. The relaxation is as important as the contraction. An overclenched pelvic floor can backfire and worsen performance. Combine this with glute and core work, hip thrusts, bridges, squats, and you're training the entire sexual support system. Resistance training 2 to 3 days a week improves vascular health, insulin sensitivity, and confidence. Heavy compound lifts don't keep testosterone permanently elevated, but they do sharpen the hormonal orchestra that supports libido and energy over time. Men who build leg and back strength tend to report better erectile firmness, not because they spiked T, but because they improved blood flow, nerve function, and self-efficacy. And as for sitting all day, your pelvis doesn't love it. Prolonged sitting impairs circulation, shortens hip flexors, compresses the perineum, and nudges your nervous system toward passivity. Stand up at least once an hour, walk for a couple of minutes, and aim for 7,000 to 10,000 steps by day's end. If you cycle long distances, make sure your saddle doesn't create numbness. adjust fit, and consider a split nose design to protect the pudendal nerve. When you carry yourself upright, head over chest, chest over pelvis, you aren't just looking confident. You're aligning the diaphragm, pelvic floor, and abdominal wall so pressure and blood flow move freely when arousal builds. I often get asked about semen retention. Here's the medical perspective. There's no strong evidence that retaining semen boosts long-term testosterone or saves vital energy in a way that transforms health. A small study suggested a temporary rise in testosterone around day 7 of abstinence, but levels returned to baseline. That said, learning to separate the point of no return from ejaculation, sometimes called arousal regulation or edging, can be extremely useful. You're training your nervous system to pace arousal, extend pleasure, and choose when to climax. Some men report deep, wave-like sensations even without ejaculation, others don't, and that's fine. There's no single right way. What's clear is that it's wise to prioritize relaxation over force. If you experiment, pair arousal with calm breathing and soft belly, not a clenched pelvic floor. In older men, the refractory period naturally lengthens. Spacing ejaculations to match how your body recovers can keep desire high and performance reliable without turning sex into a test. Nutrition and sleep are the quiet giants. Men who adopt a Mediterranean-style pattern, colorful plants, olive oil, nuts, legumes, fish, modest lean meats, see better endothelial function, which is the lining of your blood vessels that produces nitric oxide, the molecule that literally opens the gates for erection. Leafy greens and beets are rich in natural nitrates. Your body converts them to nitric oxide, improving blood flow. Excess ultra-processed foods and high sugar spikes inflame vessels and dull nitric oxide signaling. Alcohol can feel like a shortcut to desire, but is a known erection thief. Keep it light or skip it if performance matters that night. And sleep, non-negotiable. A week of 5-hour nights can drop testosterone by 10 to 15% in healthy young men. Add decades, and the effect compounds. 7 to 9 hours, with a consistent bedtime and morning light exposure, resets the hormonal rhythm that fuels libido. If you wake choking or gasping, or your partner notices loud snoring, test for apnea. Treatment often restores energy, mood, and sexual function. Another underappreciated factor is stress hygiene. Chronic stress and unresolved conflict flood your system with cortisol and adrenaline, both antagonists of sexual blood flow. Brief daily practices, 10 minutes of breathwork, a slow walk after dinner without your phone, a short body scan before intimacy, aren't nice to have. They are vascular training. Nature amplifies this effect. Time in green spaces lowers cortisol, improves heart rate variability, and lifts mood. Men often tell me a single hour on a trail or by the ocean rekindles a felt sense of vitality they thought they'd lost. You don't need a mystical framework to benefit from it, though if you think in terms of energy, that grounded feeling you get outdoors aligns with what many describe as being centered in their body. And most important, some men often ignore. Sunlight matters too. Vitamin D deficiency is linked with lower testosterone and mood issues. A morning dose of daylight sets your circadian clock and supports nightly sleep. The dominoes that line up behind it include libido. Let's speak plainly about medications and when to use them. Phosphodiesterase 5 inhibitors, sildenafil, tadalafil, and the like, are safe and effective for most men, and can be a bridge back to confidence while you're rebuilding the foundations. They enhance the body's own nitric oxide signaling. They don't create desire, but they do make arousal more predictable. Do not combine them with nitrates used for chest pain, and discuss them with your doctor if you have complex heart disease or take multiple antihypertensives. If your morning testosterone is repeatedly low, and you have clear symptoms, low libido, low energy, low mood, testosterone replacement can help the right patient, with monitoring for red blood cell count and prostate health. It doesn't cure every erection problem and often works best alongside lifestyle changes and, when appropriate, a PDE5 inhibitor. And a word about sexual media and novelty. There's nothing inherently wrong with visual stimulation, but brains adapt to what they consume. If you notice that high-intensity digital content makes partner sex feel flat or anxious, take a reset. Many men find that dialing back restores sensitivity and eases performance pressure within weeks. Create novelty with your partner, new environments, new pacing, more sensuality, eye contact, not just new images. Libido loves surprise, but it thrives even more on safety plus surprise. All of this comes together not as a rigid program, but as a way of living in your body. Picture a future you who moves daily, lifts with intention, stands tall, eats color, sleeps deeply, breathes slowly when arousal rises, and treats intimacy as a shared exploration rather than an exam to pass. That man doesn't rush to the finish line, he rides the wave. He knows his medical numbers and keeps his arteries young. He trusts that desire can be invited, not forced. He also knows that if a rough patch comes, he can talk to his physician or a certified sex therapist without shame. If you're ready to start tonight, make it simple. Take a 15-minute walk after dinner and notice your breath. Later, share a kiss that lasts longer than usual with no agenda but warmth. When arousal comes, slow down a little more than your habit. If you're not aroused yet, don't label it a problem. Give your senses a chance to wake up. If your mind tries to evaluate, come back to the feeling of your chest and belly moving with each exhale. Tomorrow, schedule your checkup and block 2 strength sessions on your calendar this week. In a month, many men are surprised by how much has changed. In 3, they're surprised they ever thought this was only about age. You are not at the mercy of time. You are in conversation with it. When you align your biology, blood vessels, nerves, hormones with your psychology, attention, calm, connection, you don't have to choose between stamina and satisfaction. You can have both, more reliably and with a depth that only life experience can bring. If you've enjoyed the video, I'd like you to rate the video on a scale of 1 to 10 and let me know in the comments. This is your Dr. Fiona signing off. Until next time, take care and have a good day.